Well, thank you so much, Azri. Now, Police Minister Bheki Cele has made it clear that there will be no sale of cigarettes and alcohol during the lockdown. Various studies have shown that smokers are more at risk of succumbing to COVID-19 because their lungs have become damaged from smoke inhalation. And those who either have or have had tuberculosis are also more prone to the coronavirus. The Executive Director of the National Council Against Smoking, Savera, Kalideen, joins us now via telephone. And thanks so much for your time this morning, Savera, and thanks for speaking to us on Morning Live.
Good morning. Thanks very much for having us.
Savera, let's start with the elephant in the room. Now, obviously, as an anti-tobacco group, you have a vested interest in the ban on the sale of cigarettes. So your organization has noted various studies, though, on smoking and COVID-19. So please tell us more about that.
Okay, so basically we are a public health and prevention lobby group, and we focus on tobacco. And you're right, we support the idea of, reducing the number of smokers in South Africa. So what we know about COVID-19 is that research out of China and the CDC tells us that if smokers do get COVID-19, the disease progression for them is quite severe. This includes things like needing ventilation, as well as getting pneumonia. And if they do get pneumonia, they get a more severe form of pneumonia. So that is one of the reasons that we assume that that during the lockdown. Cigarette sales were banned. The other thing, Sakina, is that, during this lockdown, all of us have been called to reduce our activity, and only essential workers are moving around or should be moving around. And, we're all practicing social distancing. So by not selling cigarettes, all of the workers in the tobacco industry, from the people in production in factories to those that are involved in distribution, who would have had to drive all around the country to deliver cigarettes to retail outlets, as well as the packers in all of the shops that sell cigarettes, are now able to practice social distancing and stay at home. This means that both they and their families are protected from exposure to COVID-19. And we know then that is going to reduce the impact on our health services. It's going to reduce the demand for health services, and it's going to keep more people healthy. And, that's another reason, that we think that this is good, that there is a ban, because many more people are being protected and not exposed to the COVID-19 virus.
So, Vera, many people also concerned about withdrawal symptoms, though, for those who have been chronic smokers for years on end. So how do you suggest they deal with that?
Yes, so that's an excellent point, Sakina. So from the time this evidence came out at the beginning of March, we've been communicating with the public, encouraging them to stop smoking. We ourselves run a telephone counselling quit line on 011-720-3145. If people call us, we are also able to connect them to a WhatsApp group if they were interested. This is something we do all the time, and they get 30 days of messages motivating them and providing tips. But also, we've been providing, since the lockdown, links to other organizations like SANCA, like Lifeline, like the South African Depression and Anxiety Support Group, all of whom are providing professional counseling for people that might, be struggling at this time with withdrawal symptoms. And of course, the pharmacies and clinics are still open. Clinics themselves don't provide nicotine replacement therapy, but for people who want to buy them, those are still available in our pharmacies. And we expect that the people that would have severe withdrawal symptoms are likely to be those that, smoke maybe 15, 20, even more a day. But the majority of South Africans smoke between 5 and 7 cigarettes a day. So, although we are not unsympathetic to their to their trials, we know that it's likely to be a minority of people that are experiencing severe withdrawal symptoms. And, we think that there is sufficient support that is available, and we urge them to access that support.
Savera, you touched on that relationship between COVID-19 and tobacco smoke, but what about e-cigarettes? What about vaping? What about, what do they call it, hookah pipes and the like? What's the correlation, the relationship there?
Well, it's exactly the same as cigarettes, because many e-cigarettes also have nicotine, the hookah pipes as well. And so any tobacco product, basically. So whether it's hookah or shisha, if it's any kind of e-cigarette or vape product, as well as any cigarettes as well, all of them are not listed as essential goods in the lockdown regulations. So none of them are available for sale. But all of them would have, are likely to have similar effects on the respiratory system, because they already cause health harm. We've already seen evidence about e-cigarette or vape harm. We know about health harm from shisha. There's an additional harm from shisha because people often share the pipes. And, they could get TB or they could get herpes if they're sharing that pipe with someone else. So in terms of a public health message, we always ask people not to smoke because of the extensive research that shows health harm to every single part of the body. And now we've got evidence, particularly around cigarettes, but we know that it will probably apply to the other two tobacco products that it's Savera, Kalideen.
Okay, unfortunately, we seem to have lost Savera there. Savera Kalideen is the Executive Director of the National Council Against Smoking, and talking to us there about the effects of tobacco smoke and damaged lungs in light of this COVID-19 pandemic and what it would mean, and also pointing out that there are some avenues available for those who may have decided to quit at this time or are suffering withdrawal symptoms. With that, I'm going to hand you over to